Queen Camilla's recent health setback, marked by a chest infection, disrupted her usually robust schedule of public duties. Known for her resilience and active participation in royal activities, the Queen's sudden withdrawal highlighted the often overlooked strains and vulnerabilities even public figures face. The chest infection led her to take an unexpected hiatus, following medical advice that prescribed several days of complete rest at home. This step back from public life coincided with some of the most poignant and traditional events in the royal calendar, amplifying the impact of her absence. One of the key engagements Camilla missed was the Field of Remembrance service at Westminster Abbey. This annual event, rich in symbolism and respect for veterans and those who served in the armed forces, usually garners significant attention. The Duchess of Gloucester represented the royal family at this event in Camilla's place, stepping into a role that underscored the monarchy's commitment to remembrance and duty. The substitution was a testament to the strength of the royal family's network, which steps up to ensure the continuity of its obligations. In parallel, King Charles carried on with his planned engagements, a necessary move that emphasized the balance between personal concern and public responsibility that defines royal life. One such event was the reception for Olympic and Paralympic athletes at Buckingham Palace, a gathering that celebrates national achievement and perseverance. The event proceeded without Camilla, showcasing the king's dedication to maintaining the monarchy's public-facing duties during challenging personal times. Camilla's absence from the Cenotaph War Memorial Service on Remembrance Sunday further highlighted the seriousness of her health concerns. This event is particularly significant in the UK, symbolizing national respect and remembrance for those who have given their lives in military service. King Charles, Prince William, and other members of the royal family solemnly led the service, laying wreaths and observing a moment of silence alongside military personnel, officials, and the public. Camilla's absence at such a central occasion was notable and underscored her doctor-advised rest period as critical. Despite her missed appearances, plans were soon underway for her gradual return to public life. Camilla's schedule, carefully adjusted for her health, included an upcoming reception for the Booker Prize at Clarence House, a nod to her well-documented support for literary endeavors. This appearance would be brief, designed to signal her recovery while avoiding undue strain. Similarly, she confirmed her participation in a gathering at Buckingham Palace to honor the TV and film industry, albeit with a planned partial attendance. These cautious steps reflect both the seriousness of her recent illness and her dedication to returning to royal duties as her health allows. However, in a bid to ensure a full recovery, Camilla decided to forego the Gladiator II premiere. The decision to skip this glamorous event was a prudent move, aimed at prioritizing her health over public appearances. This gesture underlined a commitment to sustainable recovery, signaling that while she was keen to resume duties, her approach would be measured. The official statement from Buckingham Palace on November 9 provided clarity and reassurance, emphasizing that her absence from the Remembrance Sunday service and other key events was under medical advisement. This statement acknowledged public concern and underscored that her temporary retreat was necessary for her health, framing it as a responsible decision made in consultation with healthcare professionals. These events unfolded during a period of considerable activity for the royal family. The transition into King Charles's reign has come with its share of adjustments, including how the family collectively handles public obligations and supports one another in times of need. The recent situation with Queen Camilla offered a window into the balancing act between royal tradition and personal health. Such moments of vulnerability remind the public that, despite the grandeur of their roles, members of the royal family are not immune to common health issues. Camilla's recovery has sparked discussions about the monarchy's strategy in managing the health of its senior members. Observers have noted that the decision to prioritize her health over engagements aligns with an increasing awareness within the royal family of the importance of well-being, echoing a broader societal shift towards valuing health and self-care. Historically, royals have often prioritized duty over personal needs, a practice that has shifted as public and media attitudes evolve. The importance of Queen Camilla's participation in future engagements cannot be overstated. Her contributions to public life, particularly in areas such as literacy, domestic violence awareness, and cultural patronage, are valued both within the UK and abroad. Her commitment to causes she supports has positioned her as a key figure in the modern monarchy's outreach efforts. With her gradual return to duty, marked by appearances tailored to support her health, it is evident that the palace is adopting a flexible approach to her workload. The future looks cautiously optimistic as Queen Camilla resumes her engagements with a balanced approach. Her planned limited participation in upcoming events demonstrates a clear strategy, ensuring her presence without jeopardizing her health. Observers will watch closely as she continues to navigate the demands of royal life post-recovery, reinforcing her reputation as a resilient and dutiful queen. The ongoing commitment of King Charles, other royal members, and senior figures to maintain public engagements also highlights a broader adaptability within the royal structure. Queen Camilla's experience underscores the challenges of maintaining public duties while prioritizing personal health, an intersection of responsibility and vulnerability that resonates universally.